Medications silently damaging your GFR. This is not a theory. According to the National Kidney Foundation, more than 1 in 3 adults over 60 takes medications that can reduce kidney filtration without warning. Source available at kidney.org. And today I want to show you exactly how these drugs quietly chip away at your GFR, even when you feel perfectly fine. But here's the question no one seems to ask. Why are so many older adults doing everything right and still watching their kidney numbers drop year after year? They cut back on salt. They drink more water. They avoid red meat. They read every nutrition label. Yet their GFR keeps sliding and their urine still looks foamy. Why? Because the kidneys are not only affected by what you eat, they are deeply affected by what you take. And most people never connect the two. I see the same patterns over and over. They stop drinking coffee. They switch to low-sodium foods. They limit protein. They even try herbal teas. But they continue using the same pain pills, the same heartburn medications, the same diuretics, believing they are harmless. That one oversight keeps slipping through, and it is costing them years of kidney function. And here's the twist most people never hear. The biggest threat is not a large dose. It is the small daily dose you take for months or years. The dose that seems gentle. The dose that feels safe. The dose your kidneys quietly struggle to handle. Think of your kidneys as a careful filter. Every pill sends a signal. Some medications widen the blood vessels feeding the kidneys. Others tighten them. Some cause dehydration. Some raise inflammation. And your kidneys read these signals almost immediately. And if those signals push your filtration system in the wrong direction, even slightly, no amount of healthy eating or hydration later in the day can fully undo that strain. It creates a slow drip of damage that builds year after year. So today, I want to cut through the confusion. No fear tactics. No guesswork. Just clear science practical steps and what thousands of older adults have done to stabilize their GFR without taking a single new supplement. Let's break this down together and start by understanding the problem behind the medications most people never question. Most people think kidney decline happens because of aging, poor diet, or dehydration. But for many older adults, the real problem is something much quieter. Medications that feel routine. Medications that seem harmless. Medications they have taken for years without a second thought. And here is where the misunderstanding begins. When symptoms show up, people focus only on food. They cut back on salt. They drink more water. They start eating more fruits and vegetables. But they rarely look at their medicine cabinet, even though several of the most common drugs in America have well-documented effects on kidney filtration. I see the same pattern again and again. Someone's GFR drops from the 80s to the 60s, and they panic. They blame protein. They blame coffee. They blame hydration. But they never suspect the pain reliever they take twice a week, or the reflux pill they pop every morning, or the water pill their doctor prescribed years ago that was never updated. What makes this even tougher is that these medications usually help something else. They calm headaches. They reduce swelling. They manage blood pressure. They ease joint pain. So people assume that if the medication helps them feel better, it must also be safe for their kidneys. But the kidneys do not work that way. They respond to every compound, every drug, every shift in blood flow. And even small daily doses can slowly tighten the blood vessels that feed the kidneys, reduce filtration pressure, or increase inflammation over time. That is why understanding how medications truly affect GFR is the key to protecting kidney function after 60. And that brings us to the deeper question that most people never get answered. Why do these medications lower GFR in the first place? Let's break that down clearly so you can protect yourself. Most people are surprised when they learn that medications can quietly reduce kidney filtration. But when you understand how the kidneys actually work, it becomes clear why this happens so often, especially after age 60. The kidneys rely on a steady balance of blood flow pressure and tiny filtration units called glomeruli. Anything that disrupts this balance even a little can lower GFR. Some medications tighten the blood vessels that deliver blood into the kidneys. When those vessels narrow, pressure inside the filtration units drops and GFR goes down. Others reduce the kidney's ability to regulate salt and water, which forces them to work harder and triggers inflammation. And certain drugs directly irritate kidney tissue, making it harder for the body to remove waste. Over time, even mild irritation can shrink filtration capacity. What makes this concerning is that most of these medications were never intended for long-term use, especially in older adults. The National Kidney Foundation has repeatedly warned that chronic use of common over-the-counter pain relievers, certain acid reflux drugs, and even some blood pressure medications can reduce kidney filtration in vulnerable individuals. You can review their guidance at kidney.org for more detailed information. I've included the full article link down in the description. The real issue is that these changes often happen slowly. You may not feel pain. You may not see symptoms. Months go by and suddenly your lab report shows a drop you cannot explain. That is why understanding the specific medication groups involved is essential. And now let's take a clear look at the 5 categories that silently harm GFR more than most people realize. NSAIDs like Ibuprofen often feel like a quick solution when joint pain or headaches make the day harder. They bring fast relief and help many seniors stay active. But the same way they calm inflammation, they also reduce prostaglandins, the chemical messengers that keep blood flowing smoothly into your kidneys. When prostaglandins drop, kidney blood flow drops too. That is why the National Kidney Foundation warns that frequent NSAID use can reduce kidney filtration, especially in older adults or anyone with kidney concerns. Source: I've included the full article link down in the description. The danger is that this damage builds quietly. Using NSAIDs too often or at high doses can raise blood pressure, trigger fluid retention, and worsen kidney function without causing obvious symptoms. Seniors, people with diabetes, high blood pressure, heart issues, or early-stage kidney disease have the highest risk. If you truly need NSAIDs, use the lowest dose for the shortest time possible. Stay hydrated before and after taking them. Never combine multiple NSAIDs and avoid them entirely if your doctor has cautioned you about your kidney numbers. For chronic pain, ask about safer options like acetaminophen topical pain gels, warm compresses, or gentle stretching. Also keep in mind that mixing NSAIDs with certain medications, especially blood pressure drugs like CE inhibitors or diuretics, can further reduce kidney blood flow. Always check with your provider before combining them. I'm Dr. Mattheus from Kidney Health 365. If you use NSAIDs, often type 1 in the comments. If you rarely use them or this is new information for you, type 0. And don't forget to like and subscribe for more helpful kidney guidance. Now that we've covered the most common pain relievers, let's move to the next medication group that millions of older adults take daily without realizing they may silently push GFR even lower. PPIs like Omeprazole, Nexium, and Prilosec are popular because they provide fast, reliable relief from acid reflux and heartburn. For many seniors, they make eating and sleeping much more comfortable. But when it comes to kidney health, these medications carry risks that most people never hear about. PPIs work by powerfully shutting down the acid pumps in your stomach. This reduces burning and irritation, but it also changes how your body absorbs minerals like magnesium and calcium. Low magnesium in particular has been linked to kidney problems and can trigger inflammation inside the tiny filters of your kidneys. Studies published in journals like Kidney International have shown a connection between long-term PPI use and a higher risk of chronic kidney disease. The biggest concern is silent accumulation. Taking PPIs every day for months or years can raise the risk of kidney injury without warning signs.
Seniors, people with high blood pressure, diabetes, or existing kidney issues are especially vulnerable.
Some may also develop rebound acid reflux when trying to stop, which makes them stay on the medication longer than intended. If you need PPIs, aim to use them short-term and under medical guidance. Many doctors recommend 8 weeks or less, unless there is a strong medical reason to continue. For mild reflux, consider lifestyle adjustments, like avoiding late-night meals, reducing caffeine, and raising the head of your bed. These strategies can reduce symptoms without stressing your kidneys. Be cautious if you take piss alongside diuretics or medications that lower magnesium. Always check with your provider before combining them. If you've used piss before type 1 in the comments. If you've never used them or learned something new today, type 0. And if this is helpful, remember to like and subscribe. Next, we'll explore another common medication group that millions of older adults rely on daily often without realizing how much it can influence kidney filtration. Diuretics like HCTZ and Lasix are prescribed to help reduce swelling, lower blood pressure, and support heart health. For many seniors, these medications make breathing easier, reduce ankle swelling, and help control hypertension. But when it comes to kidney function, they can create problems if not monitored closely. These medications work by helping your body remove extra fluid and sodium through urine. The issue is that they can sometimes remove too much. When that happens, your blood volume drops, your kidneys receive less blood flow, and your GFR can fall. This is especially true in older adults who already have reduced thirst signals and more fragile kidney filtration. Long-term or high-dose use can also cause low potassium, low sodium, or dehydration. Seniors with heart disease, diabetes, or early-stage kidney problems are particularly vulnerable. Some people feel dizzy, tired, or lightheaded and don't realize it's actually their kidneys reacting to fluid loss. If you take diuretics, use them exactly as prescribed. Never increase your dose on your own. Drink water consistently unless your doctor limits fluids. For many people, spreading out water intake throughout the day works better than drinking large amounts at once. If your legs start swelling or your blood pressure changes, suddenly contact your doctor. Be extra careful if you take diuretics along with NSAIDs or CE inhibitors, because the combination can affect kidney blood flow. If you've ever used diuretics, type 1 in the comments. If not, type 0. And remember to like and subscribe for more kidney-safe guidance. Now let's move to another medication group that plays a major role in kidney filtration, especially for seniors with high blood pressure. CE inhibitors and ARBs like Lisinopril and Losartan are among the most commonly prescribed medications for high blood pressure. They help relax blood vessels, lower pressure inside the kidneys, and protect long-term kidney health in many patients. But they still have important risks when not used correctly. These medications reduce the pressure inside the glomeruli, the tiny filters of the kidneys. This can be beneficial, especially for people with diabetes or protein in their urine. But when combined with dehydration diuretics or certain pain relievers, the drop in kidney blood flow can be too strong, causing a sudden fall in GFR. Some seniors notice fatigue, dizziness, or changes in urine output when the dose is too high. Others may have a temporary rise in creatinine during the first few weeks. That's normal in small amounts, but a large jump can signal strain on the kidneys. Anyone with kidney artery narrowing or chronic dehydration needs extra caution. Use CE inhibitors and ARBs only under regular medical supervision. Stay hydrated, avoid skipping blood tests, and never combine these medications with NSAIDs unless your doctor specifically approves it. And if you're taking both a diuretic and an ACE inhibitor, check your kidney numbers regularly to stay safe. Next, let's take a closer look at a medication group many people assume is harmless, but can strongly affect kidney filtration when used frequently. Certain antibiotics and pain medications can stress the kidneys more than people realize. Many seniors take them for dental work infections or everyday pain relief. But some of these drugs, especially when used repeatedly, can reduce kidney filtration in subtle ways. Some antibiotics require the kidneys to clear them from the body. When your kidneys are already working hard, this extra load can temporarily lower GFR. Others may trigger allergic-type reactions in the kidney tissues, leading to inflammation. Pain medications, especially those taken without prescriptions, can limit blood flow into the kidneys, making the filtration rate drop even faster. Seniors with diabetes, high blood pressure, or prior kidney issues need to be extra careful. Overusing these medications or combining them with diuretics or CE inhibitors can magnify their impact. Sudden fatigue, decreased urination, or swelling can be early warning signs. If you need these medications, follow your doctor's instructions and never extend treatment longer than prescribed. Hydrate well unless your doctor advises otherwise. And always tell your provider about all medications you're taking so they can avoid harmful combinations. Now that we've talked about these medication groups individually, it's time to look at one dangerous combination that silently lowers GFR faster than any single drug alone. This is what doctors call the triple whammy. There is one combination of medications that lowers GFR faster than anything else most seniors take. It's called the triple whammy, an NSAID, like Ibuprofen, a diuretic like HCTZ, or Lasix, and an ACI inhibitor, or a ARB like Lisinopril or Losartan. Each of these medications impacts kidney blood flow in a different way. But when all three are taken together, they create a perfect storm inside the kidneys. NSAIDs tighten the blood vessel going into the kidney filter. ACI inhibitors and ARBs relax the blood vessel going out of the filter. Diuretics decrease the amount of circulating fluid. When these happen at the same time, the kidneys are caught in the middle with very little blood to work with. That is when GFR drops suddenly. Many seniors experience dizziness, low urine output, or swelling, and never realize it's the medication combination causing the issue, not the kidneys themselves failing. If you take 2 or 3 of these medications, do not stop them without your doctor's guidance. Instead, talk with your provider about safer alternatives, dose adjustments, and more frequent kidney tests. Staying hydrated and avoiding over-the-counter NSAIDs can make a big difference. Now that we've covered the most dangerous medication interaction for kidney function, let's move into the practical steps seniors can take to protect their GFR even while using necessary medications. When medications begin to stress the kidneys, the early signs are often subtle. Most seniors don't recognize them because the symptoms can easily be blamed on aging, fatigue, or dehydration. But your kidneys usually whisper before they scream, and catching these warning signs early can protect your GFR. One of the most common red flags is a sudden drop in urine output or noticeably darker urine, even when you're drinking about the same amount of water. Another sign is new swelling in the feet, ankles, or around the eyes. This happens because the kidneys can't balance fluid the way they used to. Many people also feel an unusual kind of tiredness that doesn't improve with sleep, or they wake up feeling heavy and sluggish. Some medications can cause headaches, dizziness, or a sense of pressure in the head when they disrupt kidney blood flow. If you check your blood pressure at home and notice random spikes or an unusual drop, that can also be tied to medication affecting kidney filtration. And one symptom seniors often overlook is foamy urine. When medications irritate the kidney filter, small amounts of protein can leak into the urine. If you've noticed any of these symptoms recently, it's important to bring them up with your doctor and ask whether your medications could be playing a role. Never stop a prescription on your own, but do ask whether a dose adjustment or alternative medication might be safer. Now that you can recognize the warning signs, let's walk through the practical steps seniors can take to protect their kidneys while still using the medications they truly need. The simplest way to protect your GFR from medication damage is to make small, consistent adjustments that reduce strain on your kidneys without disrupting your treatment plan. The first step is to review every medication you take, including over-the-counter products. Many seniors are surprised to learn that something they use only a few times a week, like ibuprofen or heartburn medicine, can still affect filtration over time. Bringing a complete list to your doctor or pharmacist once or twice a year can prevent unnecessary kidney stress. Next, ask whether any of your medications can be lowered spaced differently or replaced with a safer alternative. Many blood pressure drugs, reflux medications, and diuretics have gentler options that work just as well when tailored to your health history. Never make these changes alone, but do start the conversation. Hydration also plays a major role. Even mild dehydration can make kidneys more sensitive to medication effects, so aim for steady water intake throughout the day, unless your doctor has given you fluid limits. Adding a small amount of sodium with meals can also help maintain proper fluid balance for seniors who take diuretics. Finally, pay attention to early warning signs. Foamy urine, new swelling, dizziness, or unusual fatigue are signals worth mentioning to your doctor right away. Now that you know how to protect yourself, let's bring all of this to life with a real-world example of how medication adjustments helped one senior restore his GFR and regain his energy. Linda was 74 when she first realized something wasn't right. Her energy was fading, her ankles were puffy by late afternoon, and her morning urine looked foamier than usual. She assumed it was just age catching up, but a routine checkup showed her egg fur had slipped from 62 to 53 in less than a year. What surprised her most was that her diet hadn't changed. She was eating clean, staying active, and drinking water regularly. The hidden culprit turned out to be her medications. Linda was taking a daily ibuprofen tablet for joint pain, a proton pump inhibitor for reflux, and a diuretic for blood pressure. None of these were harmful on their own, but together they were stressing her kidneys far more than she realized. With her doctor's help, she slowly phased out ibuprofen, switched to a gentler reflux option, and adjusted the timing of her diuretic. She also began hydrating more consistently throughout the day instead of drinking most of her water at once. Within 3 months, her egg fur climbed back to 58, her swelling reduced, and her morning fatigue started to fade. What mattered most was that she didn't make drastic changes. She made informed, simple adjustments guided by her healthcare team. Linda's story is a reminder that small steps can create real progress and that understanding your medications is just as important as understanding your diet. Now, let's bring everything together with a clear conclusion and next steps you can take today. Today, we uncovered something many seniors never hear clearly: medications can protect your health, but the wrong combinations, the wrong doses, or long-term use without monitoring can quietly lower your GFR. We talked about NSAIDs, PIS diuretics, C inhibitors, and ARBs, and certain pain meds and we broke down how each of them can stress your kidneys in different ways. The message is simple and easy to remember. Your kidneys read every pill you take, not just the food you eat. And this is where the urgency comes in. Kidney problems often progress silently. Most people do not feel a drop in GFR until it has already fallen too far. That is why waiting, ignoring symptoms, or assuming everything is fine can put you at risk. The earlier you understand what affects your kidneys, the more you can protect the function you still have. But here is the inspiring part. You do not need to overhaul your life to make progress. Small steps are powerful. A medication review with your doctor. A switch from daily NSAIDs to safer pain options. Better hydration on days when you take diuretics. Asking your pharmacist about interactions. These simple choices create momentum and can help you stabilize your GFR over time. If you want one easy action today, start by writing down every medication you take, including over-the-counter pills. Then schedule a conversation with your doctor or pharmacist to review them. Many seniors see improvements just from understanding what to avoid and what to adjust. Remember, this video is educational. It is not medical advice, and any changes to your medications should be made with your healthcare provider. They know your history, your labs, and what is safest for you. If you found this helpful, subscribe to Kidney Health 365 and turn on notifications so you never miss a new video. And if you want to keep learning, watch our next video, Low GFR, what it means and how to improve it fast. It will give you the clear, practical steps you can start using today.